Today I will be talking about a very common problem which we face in our day-to-day practice. It's called obstructive sleep apnea. By terminology, it is itself is evident. Obstructive sleep apnea means there is some obstruction to the airflow during the sleep which causes cessation or stoppage of breathing. That's called obstruction associated with sleep which leads to cessation of breathing. This is otherwise called as OSA. This obstructive sleep apnea is mostly seen in obese patients with short necked individuals. This happens because while during normal sleep, what happens is as the person lies down flat, gravity is eliminated, and since the gravity is eliminated, all the abdominal contents tends to move upwards into the thorax. As we all know that during sleep, all our skeletal muscles relaxes so that we get a relaxation in our body. As well, our tongue is also a skeletal muscle. So when we sleep, what happens is the tongue slowly falls back into the throat, and already if a person is obese and having a short neck, the passage through which the oxygen passes into the lungs gets more narrower. That is why when he breathes during sleep at night time, there is a sound which is generated which we call it as snoring. When a lot of snoring happens, there is reduction in airflow, that is oxygen flow into the lungs. So naturally the passage of oxygen through the narrowed orifice gets reduced, and at a stage what happens is narrowing is so critical that there is no more air entry into the lungs through that orifice, and hence there will be stoppage of breathing. When the oxygen level goes down in the blood, the heart tends to pump faster, or the heart tends to beat faster, which can in long run which can develop into increased blood pressure. That's what we call it as hypertension, and also it can develop into abnormal rhythm in the heart. So these are the major two problems which can occur in the heart, and because of this abnormal blood pressure and abnormal rhythm in the heart, these patients are more prone to develop stroke. So what I would suggest is anybody who is obese, who has short neck and who snores excessively at night,